Hey guys, Dr. Rob here today. I want to welcome you to my next whiteboard session where we're going to cover the 8 symptoms of a fatty, toxic liver. But before we get into that, please take a second, hit the subscribe button, hit the notification button, and after you watch this, if you like it, give me a couple likes. Thank you. All right, so the first symptom that we're dealing with is joint pain. This is most commonly seen in the morning. A person wakes up, they get out of bed, they feel achy. It's hard for them to walk and move. They have to get in the shower and kind of warm their joints up until they start to feel better. They also have inflammation, so they might notice their hands don't work as well. Like it feels like their knuckles hurt. They have swelling in the lower legs, calves, or ankles, and they just kind of feel generally swollen sometimes, almost like they're retaining fluid. The next one is chronic fatigue. This is seen as like just this continual fatigue that just drags on throughout the day. They never get to a point where they feel like, hey, I have high energy, I feel really good. They don't necessarily have ups and downs, they just kind of drag throughout the day. Early morning insomnia. This we see often with the liver case where they wake up after a night's sleep, maybe they slept 5 hours or 6 hours, and they wake up and they feel like they've been run over by a truck. They're just exhausted. They're just like, did I even sleep last night? What happened? Was my wife beating me in my sleep? Was someone trying to smother me with the pillow? Like what occurred? Whatever occurred, I took a butt whooping. So there's irritability. They might be labeled as the family grouch. They're not as nice to be around. They have bad breath. Even if they brush their teeth, floss, and do all the gargling and swishing in the world, it's not really a problem of oral hygiene. It's more of a problem of their body being so toxic that these toxins fill up in the blood. And toxins smell. Like if you've ever driven by a garbage dump, right? It's kind of smelly. Well, when your blood starts to get very toxic, it starts to get smelly, and all of your blood goes to your lungs because that's where your blood picks up oxygen. And if the blood itself is toxic, smelly blood, and you breathe out, you now breathe out, right? The dragon breath. You now breathe out the funk. So no good. All right, next one we see is skin issues. This looks as psoriasis, eczema, red dots, dandruff, itchiness, body odor, and here's a really important one. Sometimes we see thyroid and adrenal problems really being masqueraded as thyroid adrenal problems. They're really liver problems because the liver plays a huge role in activating thyroid hormone and allowing the thyroid hormone to function properly in the body. It also plays a huge role in balancing the adrenal hormones. So often, or at least sometimes, people have problems with their thyroid or adrenals and they think, man, I have a thyroid problem or I have adrenal problem, and they really don't. They have a liver problem. So I hope that helped. I hope that helped you give insight into what happens, what's going on with the liver. In a future video, you'll see what to do about it. So I will not leave you guys hanging. Don't worry, I'm not giving you problems. I'm also giving you solutions. So can't wait to see you at the next whiteboard session. Thanks very much for being with me here today, guys. And again, if you like this information, give me some thumbs up. Thank you.